Older dogs can get something called geriatric vestibular disease, which can look absolutely terrifying when it presents. They tend to present very acutely, so suddenly, with a head tilt, their eyes rolling around in their head. They can be stumbling to one side, they can be falling to one side, sometimes they're sort of even to the point of rolling to one side. They can be quite nauseous, sometimes they will vomit, and this is a type of peripheral vestibular disease, so the less sort of, I guess, serious or severe form. It is actually quite common. I do see it a couple of times a year in practice, and the way I like to describe it to owners, because people tend to get worried that they're in pain, they're not in pain, but I think, and I don't recommend going out and doing this, but if you've ever drunk too much and sort of collapsed on your bed or collapsed on a chair and the world is spinning around you and you sort of feel like, that's what I think they feel like. Diagnosis is generally based on signalment, in that we're dealing with an older dog, and the physical exam findings, and excluding other causes of peripheral disease like ear infections. It is important to note that there are a lot of different reasons why dogs can present with head tilts, not just geriatric vestibular disease. It can include things like strokes, brain tumours, ear infections and other systemic disease. We do like to obviously do our physical exam, and then generally we will recommend checking their blood pressure just to make sure that that's okay, and also doing a screening blood test to rule out other diseases that could be causing these signs, things like diabetes, things like hypothyroidism. Treatment for geriatric vestibular disease is supportive. Some patients will require hospitalisation and intravenous fluids along with anti-nausea medication, but the vast majority of patients can be treated on an outpatient basis. This means that we send them home with some anti-nausea medication, and they do need sort of nursing care that you can provide them at home. It is important to put them somewhere safe and comfortable, so not somewhere where they could stumble downstairs or into a pool or hurt themselves. It is a good idea to have their water and food sources nice and close to them, and some dogs will need a little bit of assistance in sort of eating and drinking, and it's important to monitor that. Generally they will have some medication to go home with as well, and most dogs you will start to see some improvement after 2 or 3 days, and generally things will resolve in anywhere between 2 and 4 weeks. There are some dogs that will have sort of a residual head tilt for the rest of their lives, but they adapt absolutely beautifully.